So the current definitions of smoldering myeloma are actually very controversial. And the reason for that is we've changed recently the actual definition of multiple myeloma, and we included new criteria, the 60% plasma cells, the light chain ratio, and focal lesions, which took a big chunk of the ultra-high risk smoldering myeloma portion. And that requires us trying to reconfigure what's going on with smoldering myeloma. And I think it's actually very important to understand that, especially the high-risk group, because they still will progress in a chance of 50% over 2 years, and trying to understand better who are those patients and what are the criteria that define their risk. There has been the Mayo Clinic criteria, the Spanish criteria. We recently sequenced many patients, over 150 patients, and we're trying to add genomic alterations into the current definitions of smoldering myeloma. And that's important because this is for the first time we say that indeed MAP kinase pathway mutations or MYC alterations, whether they're translocations or amplification, actually can lead to progression. And in the future, when we add genomic and clinical alterations put together, we will define better the patients who have the high risk for developing active myeloma and potentially prevent that from happening. In fact, we recently launched a Stand Up to Cancer grant with $10 million grant from Stand Up to Cancer, specifically to understand better mechanisms of disease progression. So this will be the first screening study in the US. We will look for people who have high risk for developing MGUS, and these are African American or patients or family members of patients with multiple myeloma, and we'll screen them, and if they have indeed MGUS or smoldering myeloma, then we will look for biomarkers that define better who will progress and who will not, and potentially prevent that by giving them earlier therapy and preventing myeloma from happening.